In the fall of 2017, neurologist Dr. Randall from NorthShore Univeristy Health System spoke to a group of Myasthenia Gravis patients. Here's a short excerpt from his talk addressing MG pregnancy issues.
What I tell everybody is that they need a plan. If you want to get pregnant, you need a plan, preferably before you get pregnant. Because if you get pregnant and you're on a variety of medicines before you're pregnant, the first 12 weeks are extremely important in pregnancy. And you may not know for 6 weeks being pregnant. So you want to plan before. So the neurologist should be the first to know that you're thinking about conception, obviously. Is pregnancy an option? Can medicines be eliminated? Because often we can adjust medicines. Can an exacerbation be avoided? And what are the plans if there is an exacerbation? So you have to know that things could get worse. And if medications are needed, what's the risks, both the fetus and the newborn, and what are the necessary changes in the medications? And then the second thing is the effects of pregnancy on myasthenia gravis. Because myasthenia gravis will not stay the same during a pregnancy. Let's talk about a few. So if you're planning pregnancy, you need a team. You need a neurologist who does neuromuscular disease, and you'll need close monitoring. You'll need high-risk OB. Nobody with myasthenia should go through pregnancy without high-risk OB. And then after birth, you need a neonatal pediatrics, which will require planning to have neonatal pediatrics around. What do you need to consider? Well, you need to see how stable the disease has been and the severity of the disease. Have there been crises? Have there been exacerbations? How long has the patient had myasthenia gravis? So, how many people have had their myasthenia for more than 2 years? More than 2 years? How about more than 7 years? 7 years? So, the advantage of having it more than 2 to 3 years is that you get some idea of how bad the myasthenia will get. 2 to 3 years, most people have declared if they're going to need hospitalizations. Most people have declared if they'll need to be intubated. If you get through the first couple of years without that, the odds are much better going forward. If you get to 7 years, most people's disease, most people will actually have some improvement in their myasthenia if you get out to 7 years with myasthenia. So, optimally, you'd say, well, if that's true, wouldn't it be good to wait 7 years before somebody got pregnant rather than 2 or 3? Most people don't plan pregnancies almost a decade in advance. So in high school you try to just prevent pregnancies, but if you can wait 2 years to kind of see where it will be, you're in better shape than if you don't. So, poorly controlled disease is a relative contraindication to pregnancy. A relative contraindication to pregnancy. That doesn't mean you should get pregnant. It means that you should get better control before you get pregnant. It's a matter of getting things treated to a place that is safe to get through the pregnancy on medicines that are safe to get through pregnancy. So, part of the team. So, consideration. So, like we'll talk about the effects of myasthenia on pregnancy, and the effects of pregnancy on myasthenia, and how you need to adjust the therapy. There's a risk because the antibodies do pass through the placenta that the fetus won't move enough, and it can cause these joint contractures. There's also a slight increased risk of fetal loss, things that people should be aware of for pregnancy. But you should also be aware that successful pregnancies in healthy babies are the most common outcome. So there are risks. The risks are greater, but there's still a way to get through with healthy babies. Most common outcome. You can develop an exacerbation about a third of the time if you have myasthenia, but that means almost 2/3 of the people won't have an exacerbation during pregnancy. There's also the initial diagnosis that can occur during pregnancy as well. Unfortunately, the severity of symptoms before pregnancy doesn't reliably predict the course of your pregnancy. So you can be doing well before pregnancy and do poorly during part of pregnancy, but most people get through, and you can be doing poorly before pregnancy and still be able to get through. So you just have to be able to work with your doctors. So exacerbation, crisis, and admission, so people can get worse, can be in intensive care unit, and even can get better, all within the same pregnancy. We'll talk about why that happens. So, as I said, 60–80% unchanged, 20 to 40% will worsen, and I plan for everybody to get worse. Not because I'm a pessimist, but because good planning makes it much simpler when you get the call that things have gotten worse. And if you know things may get worse, you're more prepared to deal with it. So the highest risk is in the first trimester, in the final few weeks of pregnancy. And we think in the first trimester there's a lot of hormone changes, and it seems like it takes antibodies in that first trimester. So the first trimester tends to be the rough time. The second trimester tends to be pretty well controlled, as is most of the third trimester. So if you can get somebody through their first trimester, they usually will have a fairly uneventful pregnancy. And we believe that's because of alpha-fetoprotein. And alpha-fetoprotein, if you've had, known anybody's had amniocentesis and things, they look at AFP levels, and this protein is related to pregnancy. But what it does, which is wonderful, is it inhibits the bonding of acetylcholine receptors on the antibody. So if you remember from the first graph, one of the problems was you couldn't get to the receptor sites. With alpha-fetoprotein stopping the antibodies, it relatively treats myasthenia, and so they actually do better as long as you have the alpha-fetoprotein. In the third trimester, you can imagine that as Jackie's not, so if you get larger and larger in your pregnancy, if you get larger and larger, you're going to squeeze the lungs and the diaphragm and make it more difficult to take deep breaths, more difficult to breathe during pregnancy. And when you get less mobile in bed, all these respiratory things can start causing some difficulties.